I'm joined by Secretary of Health Kim Malsom-Risden and Dr. Joshua Clayton, State Epidemiologist. We'll let Dr. Clayton give today's update, and we will then take your questions. And then just a reminder that our next briefing for this week will be on Thursday.
Good morning. Today we are reporting out 29 new cases of COVID-19 in the state. This does include 8 new hospitalizations and 0 new deaths. We have had 49 newly recovered individuals, as well as 274 new negative tests that have been performed. This does bring our total COVID-19 case count to 6,326 cases. Of those, we have 808 active infections and 5,437 recovered individuals. We're currently seeing 88 hospitalizations, and we have had 81 total deaths. Since the beginning of COVID-19 testing in the state, we've had 67,003 total persons who have tested negative for the virus. We have no updates for the community impact map. The new cases by county include 1 in Brookings, 2 in Brown, 1 in Charles Mix, 1 in Clark, 1 in Fall River, 1 in Hamlin, 1 in Hanson, 1 in Lyman, 1 in Meade, 11 in Minnehaha, 1 in Oglala, Lakota, 5 in Pennington, 1 in Spink, and 1 in Yankton. For our cluster updates, we have no update for Smithfield Foods. We have 163 of 169 Demcota Ranch beef employees that have recovered. We have 108 of 124 Jack Links employees that have recovered. We have 62 out of 88 Dakota Provision employees that have recovered. And for our Aventera Arrowhead, we're reporting 39 residents and 20 staff.
This is Kim Malsom-Risden. Relative to mass testing and long-term care, we don't have an update of numbers that is complete. As of this point, we have 49 congregate residential settings that have indicated they'd like to do mass testing. That includes testing for 1,603 staff and 905 residents for a total of 2,508 individuals. That testing has commenced, and we will provide updates as we get them.
All right, I will unmute our lines, and then we will take your questions. We're ready for your questions.
Jack Connell, KEVN and KOTA.
Go ahead, Jack.
Jack Connell and KOTA. The number of tests just at 274, is that a function of the fact that it was over the weekend, or is that a lowering of the number of tests being done in general?
I think what we're seeing a little bit in terms of our total testing volume is decreasing over the weekends, and then we do see our volume going up throughout the week. And so I think the numbers that we're reporting out today are more of a function of the weekend as opposed to overall testing.
Next question.
Mark with Pioneer.
Go ahead, Mark.
These numbers are state residents, correct?
That is correct.
Do you guys release numbers for people who tested positive inside South Dakota, but their residence is outside of South Dakota?
So in that circumstance, which you would expect, more specifically around the Sioux Falls area and any other medical clinic or hospital that is very close to other state borders or individuals who might be traveling within the state, those individuals are reported back to their state of residence in order for their morbidity to be counted as COVID-19 cases in that state specifically.
Next question.
Hi, this is Jonathan Ellis. I apologize if you covered this ground. I was on furlough last week, but there seemed to be a pretty big increase in cases in Lincoln County last week. What do you attribute that to?
So we had a transition of cases that had been originally identified as Minnehaha County residents and transitioned to Lincoln County residents, which is just a factor of some of the data quality checks that we're doing to make sure that we're attributing those specifically to the county in which a person resides. And so, you know, we, again, the data that we have are provisional out there. And so, you know, what I would say is that, you know, you also have an opportunity of seeing how that may play into overall trends by taking a look at the county maps. And you can see how those new or transitioned cases, I should say, do play into an overlay with the other cases within that specific county.
Next question.
Hi, Todd, Hello.com News.
Go ahead, Todd.
This is probably for the Secretary. Once again, the President in Tulsa said that, and maybe it was a joke, maybe not, that the country needs to slow down its testing of the coronavirus. I'm guessing the Secretary probably doesn't agree with that sentiment, so I'm going to ask it a little differently. Does that make it more difficult for you as a healthcare person to convince the public that testing is important? Does it have any impact on the state's ability to test?
Well, thank you, Todd, for that question. I don't think we've seen an impact of people not coming for testing because of those kinds of comments that are made by folks outside of the state. So I don't think we've seen that at all. We have put out guidance that it's expected that providers be able to test all symptomatic individuals, as well as particularly vulnerable individuals, such as the mass testing that we're doing in long-term care and with other vulnerable populations. And so, as I've indicated before, we have a goal to test up to 5% of the population. That's well beyond the minimum requirement for states, and we feel like we will still be able to meet that goal.
Next question.
This is Morgan at the Rapid City Journal.
Go ahead, Morgan.
You said that there's 49 different residential settings that are going to be doing mass testing this week. Can you give a timeline for when that will take place, and also give us some examples of what some of those settings will be? Are they apartment buildings or?
So the settings tend to be places that serve individuals with disabilities, including intellectual disabilities, in congregate settings, so group homes. There's a few places that serve kids, so psychiatric residential treatment facilities, and again, where you see a number of young people perhaps living in closer quarters along with staff. So it's those kinds of places. There's a few different steps for mass testing to happen. We help provide supplies that are needed, and the test kits and the swabs. The facility itself has to line up a medical provider to actually do the specimen collection, and so the schedule for that varies, but we would expect that most of this testing will happen in the next 2 weeks.
And then a follow-up.
Great.
I mean, this is months away, but is there any plan for also mass testing when universities go back to campus or kids go back to schools, that kind of thing?
So we're working right now with both the Department of Education and the Board of Regents to help provide guidance and assistance to both K through 12 and universities on how they can safely have a fall semester. And so we're working on that right now. I don't have any more detail on what those plans will look like, but we know there's a lot of questions out there about that.
Thank you.
Hi, Ray from Keloland News.
Go ahead, Ray.
Related to that, last week when I asked about costs for mass testing, whether it was at long-term care facilities, and now you're talking about colleges and universities. Any idea when you'll know exactly how those costs will be paid for? Is the state still picking up all the costs?
So for mass testing that we are encouraging at the state level, again, due to vulnerable populations, we are either paying the cost directly or, providing financial support to get that testing done. There's other mass testing that happens, like more commonly in employer types of situations where it's more of a partnership between the state and the employer. And we, again, as I just mentioned, are still working through what testing might look like in the school settings, and so don't have that information in terms of cost breakdown yet.
Thank you.
Question.
Yeah, JP from KON News Radio.
Go ahead, JP.
Thank you. Following up on the question regarding doing mass testing at colleges and universities, have there been any larger corporations that have asked to have mass testing done?
Well, JP, thanks for that. We've worked with Smithfield. That effort was led by Avera, and we provided the financial support for the mass testing of that group. And again, that was a mass testing that we wanted to see happen. We've also partnered with other companies across the state, LSI Jack Links. I'm just trying to think of some of the others that, of course, I don't have the list in front of me, JP, but certainly other businesses have sponsored mass testing, and as well as some tribes. And so we've seen mass testing of tribal populations, and that's been largely a partnership too, to the degree they need anything that we can provide. We're glad to help them with that.
Thank you.
We have time for one more question.
Ray from Kellerland again.
Go ahead, Ray.
Yeah, this mass testing, the testing you're talking about, those would be likely eligible reimbursed costs under the CARES Act money?
Mass testing can be covered by insurance. So a large part of kind of how this works depends on the population that we're actually looking to mass test. But it is also an allowable cost for the CARES funding, and is part of our plan as we look to test up to 5% of the population each month.
Thank you.
You're welcome.
All right. Thank you all for joining us today. And